Hey, you! I'm your nutrition coach. My name is Jackie Poole. Welcome to Happiness is a Healthier Habit. Let's get today's episode started.
My name is Lisa Cramer, and I'm a licensed clinical professional counselor. And I work out of Illinois and Colorado. We have clinic in both areas. And we specialize in brain maps and neurofeedback. So the basics. So brain maps, the technical term is a quantitative electroencephalogram, QEEG. But you'll often see brain map or something like that on like social media and stuff like that. And that is an assessment that records your brain activity. So if the EEG is your electroencephalogram, that's your brain rhythms, like your EKG is your heart rhythms, electrocardiogram, you'll hear that, or echocardiogram. And so we can record that. You get a very silly looking cap put on your head that has, 20 plus holes in it. And this electroconductive gel gets squirted into the holes. So your hair is a mess after. But and that cap is wired to an amplifier that makes your teeny tiny brain waves big enough for the software to record. And so we start with that with everyone. We do 10 minutes of eyes open, just sitting as still as you can, and 10 minutes of eyes closed, sitting as still as you can. And that gives us the raw tracings of what your brain is doing. And so then I take that data and I clean it up and I get rid of eye blink and swallows and yawns and all the normal stuff that happens. And so I can remove those things with software and see just the brain activity. And that gives us a whole lot of information about what's going on with you. So it can show us emotional dysregulation. It can show us depression or anxiety indicators. It can show us learning trouble, signals that would indicate you were primed for addiction. Or OCD, obsessive compulsive stuff, behaviors, things like that. It can show us, are there reduced blood flow issues? Has there been damage from a stroke? Is there concussion damage lingering, even from many, many, many years prior?
Right.
All kinds of things. So we do that first.
And so basically you could do this on anyone, right? It sounds like athletes, moms, kids, right? Anybody that's struggling with anything that you just mentioned, learning disabilities, depression, anxiety. That's very interesting. That's not one person, female, males. Do you specialize in a specific individual or common thread?
Well, we kind of work with all sorts and all ages. We've done as young as 4 and as old as 80 something. We have an 87-year-old currently. And so it's really about what does that brain map show us that's going on, paired with that person's subjective trouble, like the thing they're struggling with or the challenges that they're facing. And then we pair those things together to make a plan and a set of goals that are reachable. But my personal wheelhouse, like that I love working with, are 2 totally separate populations. But one is little kids that are having emotional trouble. So meltdowns that are out of the norm for their age and development, that are lasting 2 hours or really chronic and disrupting the house, and causing trouble at school, all those kinds of things. So that is one thing we like to do a lot of. And then I love to work with concussion and post-concussion syndrome. I was a college athlete. I have 2 children that were college athletes out of 3 of them. And I think you can do a lot with the leftovers of concussion that people don't recognize come from that impact, or multiple impacts sometimes. So those are kind of what I love to work with, but we really work with a big, broad kind of
spectrum
approach. Yeah.
Yeah. Definitely. I want to circle back to the little kids, because I cater to moms. I'm a mom myself. My
Mhm.
kids are on the younger side. They're 10, 7, and 5.
Mhm.
Can you just kind of, how would we know, or even to use the technology to go about it if this is not normal or normal? Because as a first time mom, I wouldn't know what is normal or where to go, or what are some of the signs that I would look for, also in, like you said, reading and things like that, because there's a lot of things that could help young kids
Mhm.
based on what you just said on that list. And I'm thinking for me, like my kids, right? Like
Right.
when my older one struggles a little bit with reading and just things like that, right? So how could we go and be like, hey, this would be really helpful, or signs that I could be looking at to be like, okay, let me go do this.
Right. Well, typically, there's a process. So especially with learning, let's start there. But with learning, the kids go through school, they get their, whether it's private or public school, assessments beginning of the end of the year, usually, to see, are you progressing? Are you at grade level? Are there deficits? And so those are, the standardized tests. That would definitely give some indication, but often moms have that gut feeling like something is a little off, or they just can't get over this hump. And so they're starting to struggle. And as they come through kindergarten, first grade, second grade, there's a huge variety of stages in learning. But then I think second grade, third grade, it really kind of funnels in. So those that aren't able to stay with that flow with their classmates and peers are falling off to the sides. When third grade, fourth grade happens, that's like real elementary school, like where you really have to get the concepts, and the concepts build on each other. So if they've missed a stage that has not, they haven't been able to grasp for some reason, like reading stuff, reading comprehension, all the pieces that fall with that. So one would be check your gut, right? Like trust your intuition if you feel like something is just not right. But most people come to us because they've tried the usual paths, right? They've tried tutoring. They've tried the school's interventions and behavioral, 504 plans with accommodations, or IEPs even, which is a step higher than that. They've tried talking to their pediatrician. They've tried even medications, and it's just not seeming to gain the progress that the child needs. So often there is a brain-based situation going on. So that EEG that I was explaining, that brain map, will show us, okay, what area of the brain is dysregulated? Is it the area of language comprehension, or is it short-term memory? Is it focus and attention? Those are all different areas. Or is it none of those, and it's anxiety? It's worry and scanning the room at first, what ifs all the time, and that they can't break out of that to stay with the learning process. So the learning piece, there's a lot of traditional assessments and things you're going to get for your children, and often they'll indicate, well, or the parent teacher conferences, the teacher's like, I think we have to do some extra special attention here on this, this, maybe it's math or whatever. So those are all good, because the younger they are, the faster they respond. And I'll explain neurofeedback and what that is that they're responding to in a second. But the other piece is the emotional stuff. And, we talk about terrible twos, where I laugh because I think 4 was harder.
Agreed.
Yeah. And I hear that from most moms, but once you're past that 2-year-old, 3-year-old stage, should they be having a meltdown for 45 minutes because their toast didn't look right, or the sock felt yucky on their foot, or things like that? So those situations, I would definitely encourage you sooner rather than later, because there's often something going on that is not able, it's getting in the way of the child of regulating their own emotions. Mm-hmm. They're always going to be in that overwhelm or whatever until you intervene. So that's what I would say about the kids and moms, right? And just to explain the neurofeedback part, that's the training that helps us regulate or make the brain waves that are dysfunctional more functional again. And it's a simple learning paradigm. It's operant conditioning, meaning when the brain goes in the direction we want, we reward it.
Okay.
So a person comes in, they sit in a chair, and they can watch a show, a movie, a game, or listen to something. And they have, maybe 3 to 5 sensors on their head. And nothing's going into them. It's non-invasive, this traditional type of neurofeedback.
Okay.
And so the only way it interacts, the sensors just measure what's going on. And then what they're watching is changing. So say it's a movie. If the brain's going in the direction we want, the movie is clear and bright and the video flows smoothly. And the sound is crisp and loud. If the brain goes to the direction that's causing trouble, which in the beginning it will do, right? The screen looks like a shadow comes over it.
Okay.
Or the video stutters, or the sound gets quiet. So there's a lot of settings we can choose from.
Mm-hmm.
But that reinforcement so when the screen gets dark, the brain will want to be engaged with the show or the movie it was watching, or the game or whatever. So it will naturally try a whole bunch of things very rapidly. And you don't have to do it. You're not consciously choosing to figure out, change my brainwave, right? You can't do that. So that's your brain, not your mind. But your brain is a functional, efficient, and it's a pleasure-seeking organ. So it will be like, wait a minute, I was paying attention to that and it got taken away from me. So it will try a whole bunch of things. And when it hits those brain waves we want, those levels we want of certain brain waves, the screen gets bright again. That's the reinforcement. And so very quickly, your brain starts to figure it out. So in a first session even, sometimes we can see that screen starting to stay bright longer and longer by 8-9 minutes into their very first lesson.
Mm-hmm.
We call them protocols. And then most people, so then it's a process of repeating. So that old troublesome pattern will show up and the screen will get dark, and then the brain will figure it out again. And then as you train, it will figure it out sooner and sooner in the session and start to lower the amplitudes is usually what we're training at that point. There's other methods, but that are causing trouble. And so it figures it out. And by 7, 8, 9 sessions, usually you or the child or the parent will start to see subtle shifts outside in regular life. So maybe there wasn't a meltdown one morning before school where that had been going on for years. Or maybe the mom woke up without a pit in her stomach of worry, for the first time. So the subtle shifts, then our goal is to make those more robust and noticeable. And then the goal is to make them consistent so that change is now part of you. And then we wean off and you're done.
Now, the process is the same for any type of situation. For example, like anxiety and depression, right? They're kind of similar, but you would take the same approach because you said something that kind of stuck with me. The brain is very pleasure seeking. I've always thought about the brain as smarter to keep us safe. Like it's always trying to keep us safe, right? So, when you mentioned that child seeking the room, making sure it's okay, and maybe he's just worried and, maybe doesn't want to participate because he's scared he might mess up or things like that. How does that differentiate from seeking pleasure and keeping us safe and taking the approach that you take? So is it basically the same for everyone?
No. Well, so that's a great question. And something it's really important for people if they start to look into this for themselves or a child, that you ask the practitioner. Everybody's brain is so different. So our practice is always to record that EEG first, because I'm not going to guess or assume that your brain is just like anyone else, because they're never the same as anyone else.
Right.
Even the two brains that look alike in their patterns, people have different complaints, right? So you can't guess. So the pleasure seeking part is not a conscious thing. It's the brain's ability to stay and attend to something it's involved in. So that's just a method to hold its attention. So, we often tell families, if the kids have a show or a set of movies, like movies that have a series or things like that they really like, don't let them watch them anywhere else. They should be special just for here. And so that holds their attention and they're interested in watching it. If I put on a symphony and say, close your eyes to a 10-year-old, they're going to be like, this is so boring, So, or things. So it needs to be, it's more about something that person is interested in and will engage in. As far as the approach, depression and anxiety have some relation, right? However, there are different patterns that can show up in the brain that are pushing them, and where in the brain. So we're looking at, okay, so where are your beta levels? That's a type of brainwave. It's a faster brainwave that is high beta, some people call it, or beta 3. Your fight or flight, your safety, right? We need it. We don't want it to go away.
Right.
But I don't want it being the dominant brainwave when you're sitting comfortably in a chair in my office in the regular middle of the day, right? It's built to turn on when we need it and then recede when we don't need it. But we get stuck with that on. And we see, people in the mental health field have been saying this is like an epidemic of anxiety. It's everywhere, and it's much, much, much more prevalent than it used to be, especially with the kids.
Oh, yeah, definitely.
Yeah.
So I used to work at a Texas Children's as a medical assistant for a doctor, and I was the main person. And during 2020, like we would do PHQs on the moms. We would do those, I forgot the name of the surveys for the teenagers. Though the teenagers were incredibly like the numbers just like skyrocket. Like we were we just learned to build a packet, and like these are the resources, and we just learned to have that on hand because the numbers that they were coming with like were worrisome. Like there was times that were like, hey, we should keep them here because this result, it's not safe for that. And the amount of times that we had to do that for the young adults was scary, and was just nothing that we were used to seeing, because I had been there for almost 5 years prior to 2020, and seeing that jump was kind of really worrisome because I was like, wow, what is going on? Like, what is happening? Because this was not something that we would see often, every once in a while here and there, but towards, 2021, 2022, like those numbers just were very significant in growth. And it was just scary to see that because you're so young. Like, we don't want to minimize what they're feeling, but at the same time, what is causing you to feel this way in this point in time? Yeah.
Well, I mean, and I think a lot of us have theories about that, right? About why they're coming up in a different culture of social media and constantly being plugged in and needing to measure up and needing to compare and those things, and that I'm left out, because I see friends together online that I wasn't invited or I wasn't included, or, why aren't I there? And all those, it just breeds so much trouble as far as emotional stability and sense of self, right? So, and the digital world, I think it sounds counterintuitive, but sense of self a lot of times gets generated by interactions with others. And then as we take it in and internalize it, it becomes intrinsic to us. But if we are only ever online with people, even in classrooms, they're on Chromebooks. So it's not the same. So yeah. And there's great positive psychology approaches. You've talked about this with guests, mindfulness, gratitude, strength-focused approaches to all sorts of things, emotional issues, social issues, all those things for every age. But sometimes you can do therapy or do mindfulness until the cows come home, And if there is something dysregulated in your brain, it's going to be very, very difficult to make progress.
Right.
So, the reason I think families like the neurofeedback approach is it's non-medication, and it can help getting people off medication. It's non-invasive. The one example I explained to you is non-invasive. There are other approaches, and we have like a whole menu to choose from to make it the right fit for the right person. So there are things that have stimulation, and there's a little current going into you, or red light therapy, infrared light therapy. Those kinds of things are different. But it's the families that have tried a lot of things and they just feel like, something's going on, or they've tried everything and they're ready to throw their hands up. This is a method that gives you real insight into the brain. And even adults, when we talk about women and as you go through your decades and, hormone changes and postpartum and all these things that happen with us that men don't experience, not that they don't experience hormone changes, but talking about menopause, perimenopause.
And women take it toll way more than men do on that end.
True. So those things, you can get a brain map and have a baseline as you go into your older years so that you know what is going on. The other time, if things suddenly change. So after COVID, people had a lot of trouble with focus and brain fog. Or mood things like they had put to bed decades before. Maybe they had panic attacks in their teens and young 20s, but never had it again. And then they got the virus. And all of a sudden those are showing up again. And they're like, what is going on? And that virus, for some reason, seemed to unearth prior mental health struggle stuff, whether it's cognitive, like thinking patterns, or emotional stuff. Or if a high fever of anything, not necessarily COVID, can kind of wreak havoc. Yeah. A head injury for sure. And most people don't correlate the mental health piece that fallout from a head injury. Mm-hmm. Having trouble thinking straight, memory is impacted. Complaints of brain fog.
And that's just if it happens once, right? Like if they've had multiple injuries, especially for athletes or younger adults, or, you said you have college athletes, like all of that. Taking one is a big deal, but taking multiple hits to the brain, to the head, I mean, very impactful and traumatic. And even though we recover and we might be, 100%, or we think we're 100%, we can never really figure out what's going on with the brain.
Right.
Until you're.
But you can now, right?
Yes.
And, even if, I say this to friends and family all the time, but before you put your child on any medication for a mental health issue, get an EEG done. Partly because it will help, it can, in the right hands, help direct what medications are a good fit and what are not. It can help say, well, wait a minute, we don't want to put them on a stimulant because they have too much overarousal already. And that might really give them some more trouble, right? Or there's subclinical seizure activity, epileptiform activity. You don't want to put them on, certain drugs that would maybe potentiate a seizure, those types of things. And a psychiatrist that's prescribing without looking at that doesn't know.
No, absolutely. I mean, there's that study where, exercise works way better, strength training specifically works better than SSRIs. And so it's quick to be like, okay, let's put you on this without also prescribing. Let's make sure we're getting outside, we're walking, we're strength training, even if it's like once a week, like doing something else, because it's really clear that exercise works way much more impactful in your mood and how you feel, in your cravings, your energy, like all of the things that maybe like if somebody with depression could, I don't feel like I'm in the mood. I just want to stay in bed. I don't feel like doing anything. And sometimes even like forcing yourself to get out there. I know like for me, when I exercise, I feel more energized, more energetic. I'm ready to go. I feel more pumped. I feel in a better mood. I feel like I did something. So it puts me in a different mentality. And I've never felt this way. So I know I can't be like, oh, I've been there before. I've never, hit like a depression after my 3 kids. I never got like baby blues. I might have felt a little, I feel like I was getting there, but I kind of like got out of it. So I don't feel like I was full on baby blue depression or anything like that. But I've always also learned to be very active, and that specific research just shows the impactfulness of strength training, and even combining the two. It's not saying like, oh no, you should not take that, right? But also just prescribing the act of moving can be, work way much better than just like, here, just have this and let that be.
Yeah. Well, and there are definitely times where medications are warranted. If we're suicidal, if there's panic attacks, if there's things that are really, really impairing function, we have to do what we can do to stabilize first. But then there are options, right? And depression and even advanced anxiety kind of situations are syndrome, meaning they're a whole body situation. It's not just feeling sad. It's not just having a down outlook. It's your thought abilities have changed. Your sleep is impacted. Your appetite changes. There can be body pain and literal, like you feel heavy, your legs feel heavy. I can't get my legs out of bed.
Well, people with panic attacks, like the that's a body manifestation that you can't do anything. Your body literally just locks up. You can't breathe. And so it's not just, oh, I think this way and I feel this way, because your thoughts definitely protrude to the actions that your body sometimes reacts those ways, and you can't perform literally, especially with people who've had panic attacks. Like, I can just imagine, like, I can't breathe, something's wrong with me, my lungs aren't working. So that's just an example that I could think of when you say, it's not just what you think, your body's physically acting on those thoughts that you're having.
Yeah. We have a saying, anxiety will show up physically. And so it's often a process, in therapy to say, where is it in your body? Let's notice and observe it. We don't have to fix it right away, but let's at least notice it and name it for what it is. Okay, I have a burning thing in the middle of my chest, or my neck is so tight and clenched, or whatever it is. It could be, I have my stomach is upset. It could be all kinds of things.
Yeah. Do you guys do neurofeedback and therapy as well?
Yeah, so the Illinois, so my company is Mind Body Neurotherapy. Also, Mind Body Neuro of Illinois is the same thing, and then we have Mind Body Neuro of Colorado. Illinois has more therapists as far as availability, so we do that. And it's sometimes people do therapy first and then come to neurofeedback. I would say most people do neurofeedback first and calm some things, like if we can get some stability, if we can get sleep improved, if we can, get some of the reactivity and over arousal to come down, then therapy can be amazing. But a child who's over aroused or in fight or flight, or, whatever's going on, maybe it's a teenager with a concussion, therapy is going to be really difficult to get through. So I often will say we need to do this route first, and then the changes they get, into therapy are awesome. And they can learn the skills and implement those new, techniques to manage themselves and awarenesses, so, and that I'm a therapist, so I think everybody should be in therapy at some point in their life, because the skills you learn you have forever. So that's a good stuff. But sometimes we have to handle the brain-based patterns first.
No.
So, yeah.
I like that. Yeah, definitely. Is there, I want to go back to the menopausal stage. I actually just had an event this weekend. It was in Austin, Keep Austin Balance. It was a hormone collective. It's accompanied through New You Life. They have like a transdermal gel, and it really helps balance growth hormone and other hormones. For those women who are in the perimenopause and menopause stage, would you just recommend for them to do this to see where they're at and how they could fix? Because in that stage, or like perimenopause, a lot of hormones are trying to get into that menopause stage. Sleep disruption, hormone imbalances, night sweats, brain fog, they're having all of these symptoms. Would this something that would be kind of like first in line kind of to try?
Yeah, I think what we found is it's a wonderful partner with a physician who's monitoring hormones, and whether they're adding HRT or bioidentical or other help for them, like that transdermal gel. One of the best pieces of neurofeedback that responds really quickly is sleep issues. So, I'm in my 50s, and I think all of my friends are like, oh, my sleep is trashed, right? So it's tough, right? And when you don't sleep, your brain and your resources are not full for the day. And so, you have little ones, so you are in that, but that will pass as they get older, right? But yeah, so sleep, it can really support your system as your body's trying to figure out this new level of, what am I doing with hormones? Am I adding new, a supplemental hormone, or am I going to let my body's process happen as it will? Like, the neurofeedback can support your nervous system. So I have heard, I don't know about specific research on this one, I would have to look it up, but anecdotally, that hot flashes and those vasomotor symptoms reduce rapidly, which can be a real relief for folks. Mood swings, to get those much more steady is a big relief, because not only does your family bear the brunt of that, but as the woman, you feel awful when that's going on, and it's hard to control. It's not really in your like conscious choice to say, I'm not going to have this flare of anger, or I'm not going to burst into tears, or it doesn't work like that. So those pieces can really be supported as you work through those years. So. And then neurofeedback is not an endless treatment. You do a set of it, and when you reach, like a level of improvement, we start to wean off once that holds, and then you're done. We don't usually see people back. Your brain also is an efficient organ, and so if you are functioning well, feeling better, it will hold those patterns. So most of the time,
riding a bike, you don't forget to ride the bike.
Most of the time, we see their cousin, their neighbor, their coworker, maybe their child, but not that person back. Once in a while, we can see people come back if there's a new head injury, or if surgery with anesthesia can seemingly unleash some old stuff. But usually, if they responded well in the beginning, they'll respond quickly for like just a tune-up, and won't have to do as long of a treatment. So
is this something that is covered by insurance, or it's self-pay?
Not yet. I've had a couple clients submit for reimbursement. Like, we can provide a super bill, which has all the information you need to put through Claim Yourself. That's what a super bill is. So, and I've had some people get reimbursement for the QEEG. In Colorado, a woman got that for her daughter, which was nice. In Illinois, we have tried to get it covered. And we've even had calls with insurance where the neurologist said, we need this. And they said, okay. And I wrote down the codes, and then we billed, and they're all denied.
Yeah.
So, but there is a task force in our field that has worked for years, met very hard to get this. There used to be codes for neurofeedback, and they weren't. You have to kind of nurture them in the process with the FDA, and they weren't nurtured. That's my word for it. I'm sure there's a technical term, but that they've reintroduced all that, and supposedly that is in the works, but those things move very, very slowly. So it takes time. So I'm hopeful, because it's mental health. It's proven, it's research-based. This has been around since the 50s. In the right hands with a trained practitioner, it's very safe. And the outcomes are amazing. ADHD has been super researched. Emotional stuff is a lot of research on that out there. Addiction, it's been amazing. So there's a lot of solid research showing its efficacy and all of that. But it is difficult to research because it's not the typical thing where it's easy to do a double-blind controlled study, which is the gold standard for randomized controlled trial, kind of an RCT thing. So it's hard to get that set up well, and there's no funding because big pharma.
Well, especially too, like when you said, people get better. There's no money in that, right? There's no coming back, and Absolutely. So I can see the difficulty in that when it comes to comparing big pharma and medications. It's not like they're curing anything. They're just putting a little bit of a ease on whatever's going on and hope that it doesn't get worse. As opposed to what you're doing, it sounds like if you don't have to come back, that's something that, again, there's no money
right
in that.
It's very true. So yeah, and we also do we work with all the hard stuff, but we do peak performance training, people who athletes or professionals that want to really like tighten up a certain area of their life and or in golf they call it the yips, but like you have a situation that you just get stuck in over and over again. That can be helpful for those kinds of things too. It's really fascinating to me. I love watching the transformations of people. And when I first started, my clients let me basically practice on them when I was very new to it, but it was amazing what happened,
I mean, the fact that it's invasive to me, like, sign me up, because it's, something that, you're telling me I don't have to come back. You don't have to have surgery or, crack my skull open, no lobotomies here. Like,
no.
Yeah,
I mean, most of the time you can get to where you want to get. There are a few times that are or situations where it's not a good a direction to go. One is if benzodiazepines, so they're a medication used for panic and anxiety, Ativan, Xanax, Klonopin, lorazepam, there's a whole bunch of them. But we literally can't work through that medication. So people have to wean off before, or at least be very well along the weaning process. And that's a medically supervised process that we don't do. So that would be one. The other is pot use, THC. You can make progress, but it doesn't seem to hold. So for some reason, I think it leaves your brain too plastic and you have too much. That's my theory, but for whatever reason, those seem to be the people that come back. They're like, hey, I feel like I did
even if they wing off completely, like let's
No. If you're using it continually, like several days a week or more, every day, I often will say you don't want to waste your money on this if you're going to continue with the marijuana.
So you would need them to like quit for forever.
Well, hopefully the reasons that are pushing them to reach for that are something we train into a better way so that they don't have that urge anymore, right?
No, I know somebody, that you can tell them like, there's no need, but it feels like, some of the comments I hear is I just work and function, better with it now. Like I can't not function without it because they're just so used to doing it all the time now. And it's,
it's a shame though, because it's really, really bad for your brain.
Yes. Like I've
functioning stays okay early, but with chronic use, it's bad. Really, it's really bad. They should all look into it. There's your PSA from me about marijuana. But Dr. Daniel Amen talks quite a bit about marijuana use and the brain, and he does those SPECT scans that show you kind of the volume of your brain, and they're color coded, and it shows like you want a nice plump brain without holes, and then he'll put a marijuana brain right next to it, and it's alarming.
Well, I think the same with alcohol, because he's also talked about alcohol as well. That's, he's also one of the reasons why I just kind of gave it up. I wasn't like a big drinker, but every time I would drink, it's just like my body would just, I'd have one or two drinks and I would wake up like with a major hangover,
Oh,
and
no.
I just decided like I can't. It's not fun. Like I'm only having like 1 or 2 drinks, and I feel like I'm plastered the next
Yeah.
day.
Oh,
And so
yeah.
I just gave it up. And every
Yeah.
time I hear him speak, I'm like, I'm okay. I'm okay without it. Like I'm gonna be, my brain is gonna grow, better,
Mhm.
older, especially as we get older, right? That decline is something that I like to focus on. My grandma had dementia, and so that can be scary. I have a distant aunt that is currently going through that. She's in a
Mhm.
home now, and so that I always look at that, maybe a glass of wine here and there, but I just think about the outcome. Like I'm
Mhm.
good. Like I
Yeah.
don't need to drink.
Yeah. Well, yeah, and I don't want to give up the whole next day, right? So yeah,
Exactly.
it technically is a toxin. I mean, for real, it's just been used all over the world by every culture. So it's thought of as very normal.
Yes, it's
Oh, yeah.
it's just part of our yeah, like you said, our culture, and it's weird when people ask like, why, why don't you drink? What's wrong with you? Like,
Yeah, it is pervasive.
it's so common, it's so
Yeah.
normal, and so
Mhm.
yeah.
Well, the studies, EEG guided neurofeedback for addiction are astounding. What the outcomes they get, and I know the VA in some states is using it, and there are, rehabs and inpatient recovery centers that are implementing it, and it's just so great because the relapse rates fall drastically when they include the neurofeedback. So that's pretty amazing. So, yeah. So if we're reaching for a lot of wine in our 40s as a mom or our 30s as a mom and we're fried, maybe think about that.
Right.
Yeah.
I'm good there.
Yeah.
Lisa, thank you. This was really nice. Is there anything else that you would like anybody to know? I will link your websites on the show notes, but anything specific that you would like, the world to know?
I just think consider getting an EEG of yourself or your children. So you have that baseline. And it's certainly if something's going on and you feel like there's more than just she's upset because her friend texted her wrong or whatever, or whatever, you're having a hard time every day. Postpartum is tough. It can help with that. Like just get the EEG. And there are good ways to find practitioners that are solid, that are board certified. So bcia.org or iqcb.org, and I'll send you those to put in there. But they have directories on their sites. So you can put in your state or county or zip code and find who's near you that's board certified. And we're all over the world. It's not just the US, Australia, Europe, Asia, it's South America, and America and Canada, partridges in Mexico. Yeah. So there are people out there, and we're all a pretty collaborative field. So people reach out and talk about cases if they're stuck, and they can find mentorship or consultation, and it's really wonderful that way. So I would say find a certified practitioner near you and get, look into that. If you have that sense that something more is going on, trust it.
No, I appreciate you. I will definitely have to look at that for sure. But thank you for joining me today.
Yeah, thanks, Jackie. It's great fun. Have a great day.